I'm a professor of surgery, doing liver and kidney transplant surgery, as well as vascular access surgery. Now, we talked about kidney failure. This is kind of an enigma when you say, what is kidney failure? So essentially, kidney is a very important structure in the body. Every time our heart beats, little blood goes to the kidney, which gets cleaned by the kidney. So kidney is working every minute, every second, 70, 80 times a minute. It is cleaning the blood and getting extra poisons, extra water out of the blood. We call it urine. So when the kidney fails, people have to have some sort of a replacement of that function which kidney does, and that is done by dialysis or transplant. Now, transplant is obviously not available for everybody because of the organ shortage. Transplant is not available because probably 1 in 4 kidney failure patient is suitable to get a transplant, go through a big surgery and things like that. So a lot of kidney failure patients have to be dialysis dependent. And what dialysis means is that the blood is artificially being cleaned by a machine. And for the blood to clean by the machine, which is being done by the kidney every minute, every second, people can't sit with the machine 24 hours a day. So what happens is people go to the machine maybe 3 to 4 hours a day. That is what Dr. Douglas was talking about. That is, how frequently they should have this done. Whether it's done every other day is okay, whether you should do it at home for longer duration of time. Those are the questions which are being answered right now. But bottom line is anybody who's got a kidney failure has to be with the machine for a certain duration of time for the blood to be cleaned. And for the blood to go to the machine, they need what is called as vascular access. And that is done by doing certain alterations in the blood vessels in the body. We all got arteries and veins. Arteries go from the heart to all the parts of the body. Veins bring the blood back to the heart. So we do certain subtle alterations by doing surgery, and that is called access surgery. Now, it's very important, and it's very kind of an unappreciated field because people think that, you just join an artery and the vein and you get this access done. But it's not true. If you really look at it, there was a study done in US to check about this, how successful this is. It showed that about 50 of the 100 surgeries done did not really work. So there's a tremendous room and importance for these things to get better. So that's called vascular access. And unless a person has got a good functioning vascular access in the body, they cannot get to good dialysis. And if you don't get good dialysis, then it directly affects the longevity of a person. In other words, if a person has to live longer with the failed kidney on dialysis, they need to have a good access. That's why access is extremely, extremely important. And there is a tremendous need for people to kind of learn subtleties of this field and for us to do more research in this field for anybody who's got kidney failure. So that is where the head start comes from for many of the countries. And the other aspect of it is because these countries have had a head start with coverage available for everybody, the amount of population has gone up significantly. And the countries which did this first, what they realized is the key is to prevention. So that is why if you look globally, in many of the countries, advanced countries where end-stage renal disease care is very advanced, they have started seeing slight flattening out of the curve of number of people needing dialysis. That's because of the pre-dialysis care or focusing more on pre-dialysis care. Whereas focusing on dialysis care has also improved the longevity of patients on dialysis. So what's happening is while less number of people are getting on dialysis, people who are on dialysis are living longer. So it's a huge, major global problem. The prevalence of people on dialysis is going up. So it's catching on now in places like India where there's a massive population and the coverage was the main key which was preventing it. Once they start getting coverage, the number of people getting will be tremendous. So it's a global problem.